Thank you. Good afternoon. Great to be here with all of you. Thanks to NAM for their leadership, and Dr. Kirch and Dr. Naska, and all of you. I think as someone who, as a second-year resident in the ICU, after my fifth patient had passed, I was in a position where I didn't know what to do. That the trauma of losing people that you care for has such a profound impact on you was something that, I still carry to me with this day on this issue. And so the work that we're doing had incredible impact already to have a national conversation, and we're so grateful to the American Hospital Association to be a part of it. And one of the things that I've learned in my conversations is that there aren't systems to help make it easy to ask for help. And so part of the work that we want to do is create those social connections, the systems that make it easy to do the right thing, to ask for help. And it was not only until I asked for help that I took some time off from training and recalibrated and could come back in a way that only allowed me to care for patients better and work with my team better. And so at the American Hospital Association, we've launched a new strategy in January of 2017 called The Path Forward, Advancing Health in America, where the vision is a society of healthy communities where each individual has their highest potential for health. And as an internist, a practicing internist in geriatrician and community health center, I can sign up for that mission. And my patients call me the dancing doctor, so I was really touched by the creative art expression that is an outgrowth of this effort, because I think that part of us that we can bring to patients' bedside that I do, or in my dance class for patients, is something that I think not only allows them to be physically active, but brings them together in a way that allows them to take action differently than they might not have been able to otherwise. And so part of what we've been doing is thinking about the 5 commitments that allow us to understand how we're making progress towards this vision. And those commitments are access, value, partners, well-being, diversity, and coordination. And so if we're making progress on those commitments, then we're making progress towards the vision. And through my conversations and work across the country with the nearly 5,000 hospitals we represent, this issue is critical, and it's one that doesn't have the amount of awareness among administrative leadership as we might think it does. And so part of the work that we're doing is really bringing and shining a light to it. And I start with this slide about being upstream is because the issues of workflow redesign are not just technical issues. They're issues that involve complexity of systems and people. And so think about care transitions. You could have the technical knowledge to get it right, but it still doesn't happen right. Hand hygiene, where we haven't gotten to 90% sustained rates with a significant amount of organizations around the country, or many of the other issues. And so the notion of a technical problem versus an adaptive challenge is something we've been working a lot with. And if some of you know Moneyball and have seen that movie, and the story about how a team who doesn't have the money and the wealth of the Yankees, the Oakland A's, ends up trying to address that. It's not a technical problem of replacing Jason Giambi, who they lost, their first baseman, but the notion of how are we going to close the gap. And so this notion of Brad Pitt sitting around the table and repeating the question to his staff about what's the problem. That sometimes the problem, that question we ask, is a question in which we're not identifying the right problem to solve for that context, that the context is one that's changing and different. And for an organization that represents a spectrum of hospitals and health systems, from 6-bed or 2-bed hospitals in the middle of different parts of this country, to large academic systems, to community systems, to a number of other kinds of organizations, it's important that we think about how we meet people where they're at. And so staying in diagnosis and trying to think about the problem and the design of a system is important. And so one of the things that we've been working a lot on, and now we've brought 60 dyads together over the last year, is this notion of the bridge, the gap that exists between administrative leadership and clinical leadership. And that there's been for many years this notion of the administrative leadership handles institutional management, whereas the clinical leadership handles patient management. Yet there's a shared vision, shared goals that these or groups of people have in delivering on the mission of a health system, but yet there's a tenuousness within those bonds. And this issue of addressing resilience and well-being is incredibly important now at a time when our systems are stressed, when there's incredible pressures from the external environment, from new entrants into the market, from disruptors, from mergers and consolidations, to policy and other regulatory efforts, that we, in order to realize the vision, have to have a common language for leadership and shared decision-making among administrators and clinicians. And so that's some of the work that I'll reflect on and talk about. Now, the influences, we know that there's a large systemic factors, in some of the data, 80% versus personal, 20%, and that the intersection of these three are influences that we can solve for. And that we heard earlier today, culture eats strategy for lunch, but infrastructure will eat both of it for dinner. And so I know that fishes are not necessarily seen in this way, but we think about infrastructure. I'm not just talking about the resources or the physical elements of infrastructure, but I'm talking about mindset. I'm talking about interprofessional teams. I'm talking about the support systems. Talking about those kinds of things that we may not really talk about, and we need to have those in place in order to be successful to try to move the needle on this issue and make it easy for people to do the right thing wherever they are working on that team. And this is the work that we've also been doing on the burden side, that regulatory burden accounts for $39 billion spent by hospitals each year on non-clinical regulatory requirements. $7.6 million spent annually to comply per community hospital. And so this is an issue that we align with the work of regulatory relief. And we are working very hard with the administration and with other stakeholders to really address this, from EHR challenges to systemic challenges to the kinds of requirements, including measures that matter, and getting our perspective from the clinicians in our membership to drive that through our Committee on Clinical Leadership. And also the regulatory burden costing $1,200 every time a patient is admitted to the hospital. If we can focus on the right things to care for patients, families, and communities, and for each other, then that's what we need to do and make a dent on this issue. And you want to be the kind of leader that you would follow, that leadership matters, that even in the issues of workflow and redesign, the kind of leadership that we build capacity in and emulate and model, as we've heard earlier today, can have implications as well. And one of these examples, now we think that systemic factors are really important, but when you aggregate the impact of personal resilience, it can have a profound impact on systemic and organizational change. And so we've been working with Novant Health in Charlotte. Now, this is an example of a system in a large market in which they've been thinking about how they train their clinicians. And they've trained 800, which is about half of their employed staff of physicians, through this program, as well as their nurses. So they've got about a third of their nurses through it now in a 3-day intensive. And this 3-day intensive is about leading self, leading team, and leading your organization. So in order to lead your organization, you have to be able to lead yourself and lead your team. And then the 1-day focused programs on frontline care team members. And they've seen a change in their engagement scores from the 40th percentile to the 97th percentile after 2 years of this effort. And then those that emerge from this program and this training are able to then lead efforts on dimensions optimization, EHR deployment, care team optimization, peer leadership development. And Tom Jenke is a family physician who's their chief human experience officer, has been leading this with coaches, and we heard about the impact of coaches earlier. So this is really a coaching model as well. And it operates from a deep personal understanding of purpose, keen sense of personal awareness and understanding how unconscious patterns and bias behaves and how they contribute to burnout. You focus on creating an attraction to wellness rather than a solution to burnout. and develop new mindsets, new habits, and commitments of living a life of being a healthcare athlete. The other is a focus on training to be fully present and aware and operating from one's core, and intentional daily living, and redefine the culture by establishing this strong community. And so we've developed our this physician leadership experience grounded in some of that training with Novant and one team that's happening this week for a group of 25 clinicians as a pilot, but certainly we'll expand that. The other issue is that healthcare stakeholders and a common language. So there's these stakeholders we touch, and that nexus needs to have a common language for resilience and well-being. The different stakeholders are looking at this issue from different places, and I think the NAM framework that has come through this effort could be one of those that helps create this common language for folks. And as you do that, that language grows, and that Venn diagram, the intersection, grows, and it becomes bigger and strengthens. One of these case studies I want to talk about is one of the teams that came to our adaptive leadership training, which tries to build and strengthen this relationship, was in Montana, in a rural community hospital. And so they came to our training and went back, and after attending the conference, each leader brought back a set of conversations they were going to have with the clinical team and the administrative team. And so the chief of staff and the CEO had those conversations, and then they came together after documenting the themes that they heard and developed an agenda for a common conversation, and then had that common conversation and the first PCH Leadership Council meeting to start addressing those: trust, communication, information sharing, micromanagement, transparency, respect, understanding each other in the processes better and differently, chain of command, and assuming positive intent and actions. And as a result, they've been able to do EHR deployment more effectively, lower than at more effective rates than industry standards, their care transitions, their outcomes, their abilities of leadership, and through their surveys have been sustained. And we've brought together CNOs and CMOs, dyad pairs, to think about what are effective CNO-CMO relationships. And so these are some of the ones that have come up. And we're continuing to produce tools that help advance this work. And this is an action canvas for physicians that help them prioritize using design thinking what they should start doing, doing more of, stop doing, doing less of, and have a structured conversation that they can engage in to help them get to their priorities. And so we, in these efforts, have launched the AHA Physician Alliance this January, which is about leading well, being well, and caring well. And you can't lead well or care well if you aren't well. So resilience and well-being being a critically important part of our effort. And so this is an effort in July that we're working with ACEP on improving hospital flow, saving lives, and reducing costs. It'll use some of these principles that I talked about earlier today. So thanks so much.